on to Anna Grantham from Hunter's Hope, who will be speaking about the Leukodystrophy Care Network Clinical Practice Guidelines. Thanks, Anna.
Hi, my name is Anna Grantham, and I am the Director of Programs for Hunter's Hope Foundation. I do feel like I should tell you all, just to kind of lower your expectations, I'm the only one on the agenda today without an MD, which, I don't know if it just makes me not sound as smart, but that's okay. Just be gracious with me today, especially if you have questions afterwards. Okay, so Hunter's Hope was started in 1997 by an NFL quarterback named Jim Kelly and his wife Jill, when their son Hunter was diagnosed with Krabbe leukodystrophy. And Krabbe is one of 40, 50 leukodystrophies, and when Hunter was diagnosed at 4 months old, he was told he wouldn't live past 13 months, but definitely not past 2, but he ended up living to be 8.5. But he suffered every single day of his life. And so the LCN was started and inspired by Hunter and every individual with leukodystrophies. Obviously, leukodystrophies are very extreme and severe diseases, but there's a difference between the symptoms and then some of the complications of the disease. And so the heart behind a lot of what we do at the LCN is to have a proactive approach to caring for children and adults with leukodystrophies so that there's not unnecessary complications and suffering. So the LCN mission is to revolutionize the health and quality of life of individuals affected by leukodystrophies with proactive, innovative, and comprehensive medical care standards and specialized centers throughout the US, Canada, and eventually the world. And the LCN is made up of really all the stakeholders in the leukodystrophy community. So that includes our steering committee, which is comprised of only family advocates, and I'll talk more about them in just a moment. And then also we have a coordinating center, which right now is the Hunter's Hope staff, but eventually will include other key members, medical providers, as well as data registry service providers, et cetera. And then of course we have our centers, which I'll talk more about, subcommittees, work groups, and then other partners within the leukodystrophy community, like the ALD Connect, like GLIA, et cetera. So here's a photo of our lovely steering committee. It's 19 affected family members and a genius baby. Just kidding. He just happened to be in the picture. So 19 affected family members affected by a variety of leukodystrophies. And out of this group, there's representation of 10 leukodystrophy organizations, whether it's a founder or some sort of affiliation. So the steering committee really has a good pulse on the leukodystrophy community. But one thing that's really key for the LCN is that it's patient-driven. So it's really led by the experience and needs of the patient. So, like I said earlier, Hunter's Hope was founded in 1997, and from the very beginning, Centers of Excellence for Leukodystrophies was just a long-term vision of the foundation. But we really started to put that vision into action starting in 2013, and where we started was talking to other organizations, other disease groups who have formed similar models very successfully, like cystic fibrosis and other diseases. And then some of you in this room, many of you actually, were probably at our first LCN meeting, which was kind of a very big brainstorming session to start talking about what would the LCN look like, what would the center criteria be, what should the mission of the LCN be, how would it be organized. So it's really been a group process and consensus from the very beginning. So in 2015, 2016, we started working on developing candidate center certification criteria, and then that transitioned into certified center criteria. And then we also sent a request for proposals to several different centers throughout the United States. So the way that we chose the centers that we approached, some of them were really obvious, like Mass Gen or Kennedy Krieger or Duke, who already had an existing population of leukodystrophy patients. They're who we all in the leukodystrophy community would think of for a center of excellence. But then we also approached centers who had a strong infrastructure for multidisciplinary care for severe diseases, similar diseases, like cystic fibrosis, like muscular dystrophy. And the reason why we did that is because obviously the idea is for there to be, we would love for there to be centers all over the country, all over the world. And those centers already had, like I said, experience in the multidisciplinary care. So there's a lot of overlap in the staffing. And we had a really great response. We didn't really know what to expect. We thought we would start with like 1 or 3, but we actually heard back from, I think, 16 out of the 22 we reached out to. So that's been very exciting. Okay, so our LCN centers, as you can see here, some of these are certified centers, those in bold, and what that means is that they have met or exceeded the LCN criteria. But then also they have what we call care coordinator in place. And I'll talk a little bit more about that. Some of these centers are affiliates and some are working towards certification. So it just depends on by center. So the LCN care coordinator is a nurse or nurse practitioner. And this person is really meant to be the point person for patients, but also the whole medical team. So local physician, the local team in that center, but also, you know, for many patients, they don't live near an LCN center. So the care coordinator coordinates with their hometown team as well. And the care coordinator roles and responsibilities, or job description, you could even call it, that was actually created by leukodystrophy families. So they're the ones who said, hey, this is what we want for our kids, or this is what we wish we would have had. Okay, so now I'll finally get to why I'm here to talk about clinical practice guidelines, or we call them CPGs for short. So the goal, this is a major, I'm drawing a blank. See, I told y'all I'm not a doctor. This is a key aspect of the LCN, the clinical practice guidelines, because ultimately, and it's in following other models too, but ultimately this is how we can make sure that there's a standard level of care that's always improving for leukodystrophy patients at each LCN center. So the goal of the CPGs is to establish peer-reviewed, published standards of care to ensure that individuals with leukodystrophy have the best possible medical care to continually improve their length and quality of life. So I just made this little graphic, just kidding, I took it off. It's from the National Academy of Health. So clinical practice guidelines is not something that's just a leukodystrophy care network thing. It's been around for a long time. But the idea is that you identify an issue or any kind of medical issue where you think, you know, we need more informed, we need to be able to make more informed decision as how to care for patients with this issue. And so we kind of followed this process, and this was very helpful for us because it's established procedure to do this in the medical community. So that was nice because we were learning as we went. So I was like, okay, so we're not just making this up. We knew that there needed to be care standards, but we didn't really know the protocol to follow. So a big part of the clinical practice guidelines is that they also involve a systematic review. So what that means is that you look at all the literature that's out there, and for leukodystrophies and for the care of leukodystrophies, there's not a lot of published data. So for these first set of CPGs, we're really starting a lot of times with either looking at similar disorders that might manifest similarly, that's part of the data, and then also looking at, or just coming to a consensus with a group of experts. And I think I mentioned earlier, cystic fibrosis is really the group that's pioneered this model of care for the LCN and for the clinical practice guidelines. They call theirs clinical care guidelines. We've copied them pretty shamelessly with everything we've done with the LCN, but we did change one word in our name, which is kind of how, like, you know, in high school you would write a paper, right, to not plagiarize. So it counts. So the goal here is to improve the length and quality of life of patients with these care guidelines. And to just, for those of you who aren't familiar with cystic fibrosis, since this is the model we followed, so they started back in 1955, and their care network started in 1961. And then you can see this timeline where they created the patient data registry, and that was to track the care guidelines, the standards of care. So I also thought it was important to show the improvement over time through this model of the length and quality of life of individuals with cystic fibrosis. So back, in the 60s and 50s, it was a childhood disease, and you passed away 6, 10 years old. Now, as we all know, people with cystic fibrosis are living well into adulthood, and there's still no cure. But through improved treatment, through proactive multidisciplinary care, the life expectancy and the quality of life of patients with cystic fibrosis has vastly improved. So that's our vision for the leukodystrophies too. We want to follow that same model and to continually improve the quality and length of life. And so part of the way we're doing that is through creating the CPGs, but also our next step is to create a patient registry so that the CPGs can be monitored and the outcomes, the clinical outcomes, can be followed. And then that will inform further guidelines. So the way we started this process, other than copying CF, is we created a leukodystrophy clinical issue survey. And that was created by the steering committee members. So it was created by families who are personally affected by leukodystrophies. And like I said, multiple different leukodystrophies are represented in our steering committee, but also our steering committee members, like I said, also they're parts of organizations. So they're very connected with the leukodystrophy community and the needs of the community. So the families went through and just listed commonly experienced clinical issues. And so we had over 300 participants in this leukodystrophy survey, which is a lot for a rare disease. And we had 15 different leukodystrophies represented, as well as 22 undiagnosed or unspecified leukodystrophies. And those survey results really informed the parameters of the CPGs, including the different disciplines that we focus on. So this is just so you know what the survey looked like. So we have over 80 medical providers that have been working on the CPGs. And we also, I'll talk a little bit more about each one, but I did want to mention for diagnosis, we're already on our second round for the diagnosis group. So Dr. Vanderver was the first lead author, and now Dr. Ruzhnikoff from Stanford is the lead author of the diagnosis group. And for the clinical practice guidelines, each group, there's a lead author who is a clinician, and we sent out a request for proposals. So almost like a grant application. They wrote to us and told us why they wanted to lead that group. But then we also have what we call a lead advocate, who is an affected family member. So for us, a big part of the LCN is that clinicians and families have a seat at the same table, equal voice, and I think it's really been a powerful atmosphere for creating these. Okay, so the neurology group is led by Florian Eichler, and the lead advocate is Elisa Seeger. The primary focus of this, and I should say, to go back to the survey, so the survey has really been the roadmap to creating these CPGs. So for the neurology group and all the other groups, they looked at the neurological issues that were most frequently reported as being experienced by leukodystrophy families, but then also considered which ones are the most severe, which ones are life-threatening, which ones are really affect the quality of life. So from that, they chose to focus on sleep, pain, seizures, and cognition. For musculoskeletal, Sally Evans from Children's National Hospital, she's a physiatrist. She's the lead author of that. And they're focused on hypertonia. So issues related to hypertonia we're talking 70% and higher for the patient. So they really chose that to be their focus of this first paper. And I should mention there will be more leukodystrophy network care standards following this first round, but you have to start somewhere, but it is going to be an ongoing process. For treatment, Dr. Joanne Kurtzberg from Duke is leading those, and their primary focus is guidelines regarding stem cell transplantation for ALD, MLD, and Krabbe disease. And then respiratory is led by Giovanni Perez from Children's National Hospital. He's a pulmonologist there. And their primary focus, so as we know, respiratory issues for leukodystrophy patients oftentimes are fatal. So they have a lot to cover. I think this might end up being 2 papers because it's really long right now, but this is a super important issue for leukodystrophy patients. And then finally, the diagnosis group. So Dr. Ruzhnikov from Stanford is leading this group now, and right now what they're focusing on is early diagnostic signs. So they want to educate what they're calling first line medical providers, so a pediatrician, and also child neurologists. But if your patient, they're giving case studies or vignettes of different commonly experienced first symptoms of leukodystrophies, in hopes that, like I said, just your common pediatrician and medical provider, they'll start thinking about leukodystrophies sooner than later. And then also we have a group focused on Krabbe newborn screening. That's led by Jennifer Kwan, she actually just moved to Wisconsin, but has been in New York, and a huge part of newborn screening there, not just for Krabbe, but also ALD. So the Krabbe newborn screening guidelines are actually in 2 parts. The first part has already been published, and that's on infantile Krabbe disease. And then now we're focusing on guidelines for late onset Krabbe disease. And there's a lot of similarities there with the guidelines for ALD. And I do want to mention, we haven't forgotten about ALD newborn screening. We're just partnering with Elisa, trying to support the work that she has been doing through the Aiden Jack Seeger Foundation. And she's doing a great job. So there was no need to duplicate efforts. And also she is on our steering committee. So we didn't forget about ALD, but that needs its own meeting, which Elisa has been doing a great job with. But with the late onset Krabbe disease newborn screening guidelines, very similar to ALD, patients that fall into that category, they may first present, with late onset at 3 years old, or it may be a very mild case when they're 70. So obviously, it's not just a one-size-fits-all approach to the follow-up. So this group, the infantile guidelines were a little easier because that fits into the more traditional box of newborn screening. That it's early childhood, it's timely. So there's a lot of overlap with that, and I think the groups can kind of learn from one another. So here's a picture from our most recent in-person meeting. All of these lovely people from our LCN. They've been really troopers. We've put you guys to work, right, Dr. Eichler? So starting in 2017, we've had 2 in-person meetings a year, a winter and a summer. And then in between that, lots of phone calls and emails. And one thing that I have just been so encouraged about from our meetings and from when this group all gets together to work, there's an atmosphere in the air, like you can almost feel it. And I think that that's an atmosphere of hope, because when families and clinicians are working together and being so solution-oriented to really come up with ways to solve these long-term issues that leukodystrophy patients have been suffering through for decades, it's just exciting, and everyone has really done a great job of making great progress. So as the CPGs are completed, lead authors, they're going to be pursuing publication in medical journals. So these are going to be peer reviewed, and it's not just something we're putting on our website. They're going to be available through the appropriate medical journal. Also, we're doing CPG training sessions. So at our LCN meetings, as the CPGs have progressed, the lead author is really sharing the thought behind the CPGs with the LCN members so that they can have a deeper understanding of the guideline. And then the CPGs will be available on the LCN website, so they're accessible to doctors everywhere, but also to families, which we think is really important because if we're honest, not every doctor would take the time to say, hey, what's the guide, what can I find out about this? So we feel like it's important to empower a family to be able to have access to this, to say, hey, could you read this? Let's do this. And in addition to that, we're also creating a family piece. We call it a family companion piece, so that there's a family version and it's very practical and any family can look at that and understand it. But then if you have a more scientific mind than I do, you could also have access to the medical version. And then finally, our next big project is creating the LCN data registry. And we know from CF, the way that this becomes a continual process is that from each CPG, you collect data to say, okay, is this really helping patients the way we think it is? And what can we do to make the outcomes even better? So one of the things that CF has shown us is how important it is for the advocates to own this kind of data and then make it accessible to all key players. So that's our next big project. And I think we'll just continue to learn more and, God willing, really make a difference in the lives of people with leukodystrophies. All right, that's it. Thank you.
That was great, Anna. Since the topic is similar, I thought we could move on to Adeline and then have a discussion together, because I'd love to also hear Elisa's thoughts on this since she's been thinking so deeply about this.